Welcome, everyone. We're so glad to have you joining us today for Transforming Childcare, Progress and Potential of the Massachusetts 2024 Early Education Reforms. As you just heard a moment ago, we are providing interpretation for this event in Spanish, and I'm going to turn things over to our translators for a moment just to explain how that is going to work for today's event. Is someone from Excel able to explain the language selection?
Yes, I'm not quite sure where Leon is. He usually brings up the slide, but I can give the instructions without the slide.
Sure, yeah, no problem. I'm gonna share my screen now. Okay. Good afternoon to everyone, and welcome to this webinar. It is a pleasure for us to be here providing interpretation services. And today we have a Spanish interpretation available. In just a moment, you will see this globe icon next to the word interpretation. You will find it at the bottom of your Zoom screen. If you click on that globe, you can select your language. If you have joined from a cell phone or tablet, look for the three dots button on your screen next to the word more. From there, you will see interpretation as an option in the list to choose your language. An important reminder, everyone has to select a language instead that channel. Now, I will turn it over to Shay to repeat that in Spanish.
Buenos días y ya vamos a comenzar con los servicios de interpretación. Cuando iniciamos la interpretación, va a aparecer un icono de un globo en la parte inferior de tu pantalla si estás en un computador. Ahí puedes seleccionar tu idioma preferido. Tenemos inglés en español hoy. Y si estás en una tableta o en un celular, en vez que el globo, puedes seleccionar los 3 puntos junto a la palabra more y ahí seleccionar Language Interpretation Español. Muchísimas gracias.
Okay, interpretation is available now.
Wonderful. Thank you so much. And if anyone is still looking, within the more is where you can find the globe. Thank you everyone for being here today. We're so excited to get to share more about the reforms from 2024 and the progress that has been made in this first year. My name is Elizabeth Lewan. I'm the Vice President of Public Policy and Research at Neighborhood Villages, and I'm joined today by other members of our public policy team, including Amaris Kinney, our research director, and Emmanuel Verdu, our policy analyst, who you will hear from momentarily. We are also lucky enough to be joined by a panel of providers who will speak about their experiences over the last year with some of the programs that are being addressed. We'll hear from them in the second half of this webinar. As we are presenting, we'll have 2 spaces for Q&A. Please feel free to add any questions that you might have into the Q&A by clicking that Q&A button at the bottom of your screen. We're going to keep the chat open in case there are any questions about technical accessibility needs during the webinar, but please use the Q&A if you have any content or substance questions about what we're discussing. We are going to jump in a moment to discuss the reforms that were passed just over a year ago through the Massachusetts State Legislature, particularly the ones that pertain to family affordability, operational funding, teacher compensation and benefits, and data transparency. Before we jump into the content, we just want everyone to have a better sense of who is in the room with us today. And so we're going to launch a poll in a moment. And if you can just take a moment and click whichever of these categories best describes you. Great, thank you so much. It looks like everyone almost has answered. We'll go ahead and take a look at those results. We are so happy to have such a variety of people who are invested in early education and childcare joining us today. So as I mentioned, a little over a year ago, the legislature passed a suite of reforms through outside sections in the FY 2025 budget. We're going to talk about the main reforms, their intention, what was put in legislation, how far we've gotten in a year, and the additional work that needs to be done to fully implement some of these in the coming years. There are additional reforms that we will not go in depth on in this webinar, but we have some additional materials that will make available to everyone if there are specific reforms that you have an interest in. And with that, I'm going to turn things over to Emerson Emanuel to take us through what was passed and the progress that we've made so far.
Awesome. Thanks so much, Liz. So Liz already talked about the 4 categories of reforms that we're going to be discussing today. We're going to start off with affordability. And so the 2020 part of the 2024 reforms that we wanted to first start with is affordability. And so the Child Care Financial Assistance Program, as part of the 2024 reforms, was codified into law and various protections for families. In addition to codifying that into law, there was various changes that were placed in statute, and we're going to go through a few of them. Like Liz says, there are a ton of reforms that happen in as a part of the 2024 reforms. We're not going to talk about all of them, but highlight some of them. And so for CCFA, what was one of the changes that was placed in statute was priority groups. And so the priority groups include families whose family income was 50% or less of the state median income, families that have a parent or caregiver who works in the early education and care sector, families who have children or a child with a disability and whose family income is 85% of the state median income or less, families who are experiencing homelessness, families that are headed by a young parent, and families that are experiencing domestic violence. In addition to specifying these priority groups, the reforms increased eligibility to all eligible families making up to at least 85% of the state median income. So previously it was 50% of the state median income. The reforms has increased eligibility for families. Another change is that free care for families receiving CCFA whose income is 100% below the federal poverty level. Reimbursement is based on enrollment, and EEC must establish and develop a schedule for a revised rate structure for payments to providers and sliding fee scale for families receiving CCFA. So 1 year out, the progress that has occurred in regards to the reforms that I just discussed. Actually, taking a step back, the There were several provisions that the EEC was already doing. So they were already part of EEC policy, so before codification, so they continued to do those things, but now these different reforms are law, so there's more permanence to them, as opposed to them being a policy that can be changed. But an example of some of the reforms that EEC were already doing is that they were reimbursing based on enrollment, and also they made childcare free for anyone whose income is 100% under the federal poverty line. The laws called for and gave EEC authority to make regulations to implement the changes, and so these regulations kind of help fill in gaps that legislation didn't or couldn't fill in. And so EEC had proposed and finalized some regulations in regards to CCFA, and they will become effective on January 1st, 2026. EEC has also revised rate structures and sliding scale fee for families. And a schedule for revising the rate structure and sliding fee scale for families is forthcoming. All right, so now Amaris will discuss the progress relative to the promise.
Thank you, Emmanuel. As Liz mentioned, my name is Amaris Kinney. I'm the Director of Research at Neighborhood Villages. And I'm just going to provide a little bit of context for this question of affordability. And when we say progress relative to the promise, we're talking about what the law enables, what it has the potential to do, and sort of where we are relative to that. So in terms of the current context for affordability, the Child Care Financial Assistance, CCFA, program has grown in participation amongst programs. Currently, most recent numbers, I should say, are that 69% of childcare programs are participating. A change that will go into effect as of November is that all programs will have to attest to their willingness to serve children with childcare financial assistance in order to be eligible for the Commonwealth Cares for Children operational grants, or C3. So the participation has grown, and yet still there is room for more programs to participate, and they will all have to say that they are willing to do so starting in November. Despite the increased participation, there is still a ways to go. So current CCFA enrollment among children in households with incomes at or below 50% of state median income, that's what SMI stands for, is 19%. The Child Care Financial Assistance enrollment of all children in households with incomes at or below 85% of state median income, which is the new threshold that will be going into effect, is 12%. So I'm going to explain that visually on the next slide. And these, just as a reference, we'll drop in the chat a link to a very helpful brief that EEC put out this summer related to CCFA. But in terms of what I just discussed, where we are in terms of enrollment of children in childcare financial assistance and eligibility, this is the purpose of this graph. So the full column, the top, shows you that the children eligible is a little bit more than 347,000. And we get that by backing into that number from the current enrollment, which is close to 66,000, and by knowing that that is 19% of all who are eligible. So we have close to 66,000 children enrolled. And the reason for those two bands at the bottom is that some of those are what we call income eligible, and some of them, although likely also income eligible, have gained access to childcare financial assistance through other eligibility, specifically the Department of Children and Families and the Department of Transitional Assistance. And so we see that those two bands together comprise the total children enrolled right now again, close to 66,000. And then that green band on top of that is the total children on the income eligible wait list. So their families meet eligibility requirements at 50% of state median income or below. They are currently waiting pending additional funding. And so I can share a little bit more about what that gap means in terms of additional funding needed. So those top lines are just the different places in the state budget from which money for childcare financial assistance is allocated. When you sum together the income eligible lines, you get spending in that green box. So the total allocated for income eligible children in FY26, that's fiscal year 2026, which we are currently in, is $611 million. The line under that, the red line, is the number we get by dividing how many children are currently enrolled through income eligibility into that $611 million number. And so we get that approximate spending per child for who are income eligible is about $16,000. Now, we know from the previous slide and from the data that there's a little over 31,000 children on the wait list. And so if you take that approximately $16,000 per child and multiply it by the number of children on the wait list, that yellow highlighted band of more than 496 million is the amount of additional funding that would be required to serve the approximate amount, I should say, to serve all children who are currently on the wait list. And yet we know that all children currently on the wait list does not comprise the total of all who are eligible. So we still would have a gap. And the purpose of this slide is just to show what the full potential of the law is. We want to understand that if everyone eligible at 50% of state median income and 85% of state median income, if they were all to receive childcare financial assistance, what would that figure be in terms of needed additional funding? And again, it's approximately $16,000 per child for income eligible funding. And so we multiply that by the number of children in the gap and determine that to cover all children eligible at 50% of state median income would require an additional $4.5 billion in funding. And to cover all children eligible at 85% of state median income or below would require an additional $7.7 billion. And I'm going to turn it back to Emmanuel to talk about operational funding.
Thanks, Amaris. All right, so the next category of reforms that we want to talk about is operational funding. So part of the 2024 reforms was that Commonwealth Care for Children grants, C3 grants, were made permanent. The reforms also established the Early Education and Care Operational Grant Fund. And then there were additional requirements made for program eligibility for the grants and formula for distributing funds to ensure more equity in the program and system. There are also specific criteria for large for-profit centers for C3. So 1 year out, the progress that has been made is that 92% of programs continue to participate. C3 has been funded for the third year in a row at $475 million. There has been adjustments to the distribution formula. The adjustments were made due to legislative changes in the fiscal year 2025 state budget, and the results of cost modeling. The adjustments include changes to the base rates. The base rates are now distinct for full-time versus part-time programs. For early childhood education centers, the base rates account for the age of the youngest child enrolled. And then for family child care providers, the base rates account for the presence and hours of an assistant. There were also changes made to the equity prong of the formula. And then for the fiscal year 2026 application, Amaris already talked about this before, but there are going to be additional requirements regarding providers attesting to their willingness to accept families with CCFA and to encourage providers to meet salary requirements. Also, EEC recently just underwent a public comment period on the formula, and there may be some potential formula changes for fiscal year 2027. All right, back to you, Amaris.
Thank you. So on this slide, we're providing sort of a first look at some research that will provide additional context for in the coming months in the form of a brief and an event later this year, but wanted to give folks a sense of how much operational grants, the see-through grants, cover as a portion of the cost of care for programs. And so in order to understand this better, we did an analysis of a sample of programs to look at what their costs are. And the way we can do that is to get approximate costs, because obviously without talking to the program, you don't know the exact cost, but because there is information about the cost of care that was put together by the American Institutes for Research, AIR, that on behalf of EEC, we have information about what likely costs are for programs based on their characteristics, the number of children of different ages they serve, et cetera. And so we were able to look at a sample of programs, determine what their cost approximately is, and also look at how much they're receiving in operational grants through the C3 program. Doing that analysis, we can say how much C3 is covering of their total costs to understand, to get a sense of the current value that C3 is having for programs. And you can see in the numbers here what we found. The average portion, so the amount that C3 is covering of programs' total cost is about 11% among all programs we looked at. It's a little higher for family child care programs, FCCs, at 17%. A little lower for center-based programs at 9%. And we also looked at it by different program characteristics, including COI, which stands for Child Opportunity Index, and is a measure of the program's vulnerability based on the area where it is located. It's a measure that EEC uses in terms of the equity adjustment in the funding for C3. And so wanted to look at programs' COI scores and how much C3 is covering for those programs. And in those cases, C3 is covering about 18% in very low and low child opportunity index programs. So it's higher than average and an indicator that C3 is working as intended and that more money is going to programs with the highest need. So back to you, Emmanuel.
Thanks, Amaris. All right, so our next category of reforms is teacher compensation and benefits. So part of the 2024 reforms were that they created an early educator specific loan forgiveness program. They also codified, so made into law, the early educator scholarship program and required EEC to establish the first EEC career ladder, including salary guidelines, by October 31st, 2024. So 1 year out, the EEC loan forgiveness program is not yet operating, but money has been allocated to it. The EEC scholarship program is continuing under new guidelines, and EEC has not yet released the career ladder or salary guidelines, but it is currently in development. Back to you, Amaris.
Yeah, so while the career and salary guidelines, as Emmanuel said, are currently in development, we do know from this set of robust data that EEC has that salaries have gone up for most educators, and in some cases by more than 20% over the last 3 years. Despite that progress, however, there remain large gaps in wages in order to be commensurate with public school teachers, which is the promise of the law. So essentially, the law says we want to get to a place where early childhood educators who have the same level of experience and skill as their counterparts in the public school systems have the same wages. And in this graph, we're illustrating what a gap looks like using BPS, which is Boston Public Schools starting salary. Now, we totally recognize that Boston Public School salary is not the starting salary across the state. It was a data point that was readily available, and it does represent a real gap. And so that $68,874 figure is the starting salary for BPS teachers, and that $50,107 figure is the average wage for ECE teachers, which is based on data that is collected through the Commonwealth Cares for Children program. And so that gap is over $18,000. And so I just went over those first two figures. So that number for BPS is for the 2025-2026 school year. And then the data on ECE wages was from May of this year, which is equivalent to the 50,000. And in order to understand what the gap is between what educators are currently making and what would be commensurate in terms of the level at which, in this case, BPS starting teachers are making, we took that gap of about $18,000 and multiplied it by the number of teachers in ECE in Massachusetts. And that's specifically teachers and not other educators. So this number, that additional funding required, would be to pay teachers who are in ECE in Massachusetts enough to cover the difference so that they were making a comparable salary. And that total would be $353.4 million. Back to you, Emmanuel.
All right. Thanks, Amaris. So the last category of reforms that we want to talk about is about data. So the 2024 reforms stated that EEC must collect a variety of data. They must develop, maintain, and disseminate a written early education and care informational guide. By June 30th, 2025, EEC must conduct a study and publish a report making recommendations to enhance the early education and care workforce pipeline and develop strategies to ensure the early educator workforce meets the needs of the Commonwealth and establish the Data Advisory Commission. So when you're out, EEC has been collecting the required data and reporting it out. They have developed and disseminated informational guides on their website. They haven't yet published a report on how to enhance the early education and care workforce pipeline, but the Data Advisory Commission was established and is actively meeting. Neighborhood Villages is a member of the commission, and Liz represents us on the commission, and she's going to discuss why increased data is important.
So we just wanted to take a moment, as we're discussing these reforms, we know that most often when we're talking about the transformation that needs to happen in early education, we're talking about things like affordability for families and operational funding, and these things that we see every single day to make the system function and make sure that teachers and families and children are getting what they need. And a really important component of that is actually the data collection. When we look at where early education in Massachusetts was only 5 years ago in terms of data, there was very little data that EEC had access to collect. And as a result, very little was known about the sector because of policies that EEC has put in place on their own, because of the Commonwealth Cares for Children Fund and the variety of information that programs share as part of their application and being part of that program, and as a result of a number of the data requirements that were passed a year ago, we know so much more about who is in the early education sector, how much things cost, what is working and not working, and that is so incredibly important in order to make sure that we are making policies and directing funding in a way that is going to create a thriving sector and to best serve children and families and teachers and the Commonwealth as a whole. So while when we look at the promise of data, it's a little bit different than when we think about we need to hit this figure for C3 or have this many families have access to affordable childcare. It is a really important component when we think about having a thriving early education sector in Massachusetts. We are going to get into our panel in just a moment. Before we do, we just wanted to take a few moments to answer some questions specifically on the information that was just shared. So we have several that have been dropped into the Q&A. Thank you so much, those of you who have submitted. I'm only going to field a couple of these right now because we want to be really respectful of our providers' time. They're taking time away from actively running their programs to be here with us today. And we'll get to the rest of these questions towards the end of the webinar after we hear from our panel. But one question is about the data that was being shared earlier about CCFA and how many children are enrolled or eligible, and whether that accounts for children who are in Head Start or in public pre-K.
So I can attempt to answer that. I may need to follow up with you, Jan. And I will just say that I'm not an expert on Head Start. However, I didn't look specifically at Head Start, but I do know that in most cases, I would say children who are being served by Head Start are also receiving funding through CCFA because of the hours of programs and for a variety of reasons. So we would expect that there is a lot of overlap between those children who are currently enrolled in CCFA as well as enrollment in Head Start. That being said, there may be a slice that is sort of not accounted for in terms of they are in Head Start but not enrolled in CCFA, and we would expect them to be part of that group that is eligible and in that gap. And so we also don't expect that gap that I showed, that orange part of the chart, that everyone in that category would necessarily want to enroll their child and receive childcare financial assistance. That was more to illustrate sort of the gap between where we are and where and who could potentially want to access it, and sort of the need for additional funding. I don't know if that, in terms of the second part of your question, do they track where children fall in terms of 50 or 85% SMI and preschool programs? It's a program specific question, and I think the answer is typically no, although Liz, you can chime in if you have a different thought for that.
I think if the question is once children are receiving childcare financial assistance, so the system has a number of different components. The programs, I don't know of any, and we can certainly ask our panelists this, are not tracking that. When a family receives childcare financial assistance, either through a contracted slot or a voucher, there is income verification. And so the state of Massachusetts does know what families' incomes are, because they are paying a different fee based on how much income the families are making. In terms of the aggregate data that Amaris was sharing earlier about how many families are eligible, the data that we're pulling from at least is not breaking out by smaller income increments, although certainly we're happy to do a deeper data dive and have that conversation with folks in another setting. I'm noticing the time, and I just want to be mindful of our panelists. We are excited to answer the rest of the questions that are being asked towards the end of the webinar. If you have questions that have come up already, please feel free to put those in the Q&A, as well as any questions that come up as we are talking with our panelists. So with that, I'm going to ask that we just pin our panelists, and if they can come onto video and off of mute. And if we can just remove the slide so that we can see everybody. Thank you so much for being with us today and for taking time away from your very busy middle of the day running programs to be here with us. We're really excited to hear about your experiences with the various programs and reforms that have been passed and implemented in the last year and going forward. I wanted to just start, can each of you take a moment and just introduce yourselves, let us know what programs you represent and where you're located.
You first, Ellen.
I'm Ellen Dietrich. I am at Temple Beth Shalom Children's Center in Needham. We have children ages 12 months through 4th grade. We have about 330 children, and we've been around a long time. We've been here since the 1960s. So I'm happy to be here.
My name is Antonio Pagan. My wife, Nubia Baron, that was here before, but had to leave to get busy with the kids. We started actually recently in 2023. We have a family childcare located in Hadley, and we serve mostly CCFA children, and basically we have from 6 months through 4 years.
Great, thank you both. The first question I have for you, and you heard earlier, we were talking a little bit about the Commonwealth Cares for Children program and it being made permanent as one of the main legislative reforms that happened a year ago. And I'm just wondering, for each of you, what has the impact been of that program now in this last year being permanent rather than continuing on a 6-month to year-long basis?
So, for us, that's been huge. We are using the funding exclusively for educator salaries. And that's a good thing. That's our, just like what we've been hearing about, that is the most important thing, right? Any school, it all depends on the teachers. So we wanted to put all the funding towards that, but also at the same time, it felt really risky because if we're looking to raise their salaries and then the funding gets cut, we were in this constant cycle of fear of what were we going to do, because cutting people's salaries we knew wouldn't work. So so for us, knowing that it's a permanent part of the budget has been critical. It's made us feel much more comfortable with continuing to try to really use every penny to address salaries. And so that's our plan. That's our plan going forward. And teachers know it. We've been very clear, very transparent about that in the same way the state. We're trying to reflect the values of the state and the C3 program in our program. So to really mirror that.
Thank you. How about for you all, Antonio?
In our case, it's similar, but not exactly as a start off. So we had a lot of costs on the first year. We actually started with C3 funding about 5 months after we started. But I have to say that most of the money goes into salaries because we decided to actually have, even when we had 6 students only, we decided to get a certified assistant for 2 reasons. One, because we wanted to be able to work on expanding our services. And number 2, because we want to be able to mentor some people coming. And in this area, Western Massachusetts, there is a very bad situation about capacity. Mostly where we are, we have, even though we are new to the area, we got a lot of requests from people, both on the CCFA side and the private. It's amazing how many people are without childcare, and they come desperate sometimes. So we decided to use that funding for salaries, and also we actually require we have 2 assistants part-time because we cannot afford to pay full-time, and nobody's available for full-time. But we actually request them to basically continue getting credits and getting prepared with the promise that we will raise the money. And we've been doing it since we started. That is being successful. I think it's going to help us in the future. We now have 8, the license is for 8, and it's soon to become a 10 children license. Definitely without having 2 things: the amount of money that we get from the C3, and secondly, knowing that every month you are going to have the same amount. I don't think that we will take the decision of having an assistant. Thank you.
And Ellen, I see you nodding.
Yeah, I was just gonna add that one of the things that the C3 funding and knowing that it's permanent has enabled us to do is create a salary model. So similar to a public school where there's incentives for longevity and education and experience and credentials, we've built that into our model so that teachers know where they're going. And I think similarly to Antonio, because they know that, it helps. Well, a teacher today said they're really eager to get their lead teacher certification through EEC because they know that they'll move up in our salary model. And we can only do that because of the C3 funding, because it's a lot of money. So if we're giving an extra $2,000 a year, for example, we wouldn't just have that money except for the C3 program. So knowing that it's coming and it's the same amount every month, we can provide these types of incentives for teachers to learn and grow.
You just touched on this a little bit, but for both of you, I'm wondering if the consistency of knowing you're getting the same thing month to month, or the amount that you're currently getting has allowed you to make investments either in teachers or in other aspects of your program that you otherwise would have opted not to.
Yes, 1000%. We were very lucky to, in 2019, we were experiencing teacher turnover and wanted to really address, and teachers were telling us, you know, why would I teach if I could be paid more to be a cashier at Target, that kind of thing. It's a much easier job, or at least it's perceived as a much easier job. And I'm doing a really hard job at getting paid less, and I get fewer benefits. And so we took a hard look at that and said, we need to, you know, create this salary model, and we need to think about how to raise them. But at the time, the only way we could think of raising them was by raising tuition. And we thought, you know, to raise, maybe over the next 10, 20 years, we need to raise tuition 30, 40, 50%, something like that. But we wondered then, how would people afford it? And it wasn't adding up for us. And of course, no one expected COVID and everything that followed. And then we were really able to use the C3 funding to get much further, I think, in our plan than we would have otherwise been able to. So for sure, 1000%, there's no way we could have done it and be at the place where we are. I mean, even on the slide where it said the average early childhood teacher salary is 50,000, I actually think that's high. We are just hitting 50,000 starting this year, and you still see that 50,000 has it's not, you know, it's not competitive. So I think we all have a long way to go, but it's been super helpful.
Yeah, definitely. Two things is number one, when we started, you know, without knowing a lot of things, we were not considering to basically hire assistants until actually we started learning about C3. And then on the first year was different. We didn't know many things. So we got a little help. Once we get on the second year that we started, that's when we move forward to get the certified assistants. And definitely without that, we were not thinking about having an assistant. We were not thinking about increasing the amount of students, because we knew that by increasing the number, and you know, if you add that the CCFA amount that we get per student is definitely not comparable with the cost. Adding students will actually be a burden to us. We will not be able to do more than 6 ever. But with the C3 funding, actually, we actually had conversation. Actually, yesterday, the licensor was here on the site visit, the annual site visit, and we discussed exactly that. The reason we are actually moving forward for a license of 10 is because the situation now is completely different. We can't afford it because of C3. And Ellen mentioned something that is important. We are competing on a market that the benefits, the fringe benefits, are huge in many cases, not only for teachers on the public schools, but in many companies around us. So the C3 is not a fix all. I think that there are other opportunities that we should be looking at, in the sense of there are ways for early childhood educators to get benefits by being creative on the state side, and allow us to basically participate on basically group health insurance or other things that they have available that we should be able to work out. So C3 is great. It's not the solution for everything, but it's helping us help others.
One of the main objectives of the reforms that were passed a year ago, in addition to supporting educator salaries, which you've both been talking about, was to address the affordability issue for families. Right, almost a third of families in Massachusetts are either going into their savings or going into debt to pay for early education. And those are the families that can figure out even that as an option. We know a lot of parents have had to drop out of the workforce. There's affordability is a major challenge. And so I'm wondering for you all, both of your programs accept childcare financial assistance and also have tried to address affordability in a number of other ways. And I'm curious how the reforms that have passed, either related to childcare financial assistance or C3 or just in other ways, how you're seeing affordability be impacted in this last year.
I mean, we were encouraged for many years. Like I said, we've been around since the 1960s, and it wasn't until 2023 that we started to participate in the CCFA program. And I think, we're based in a house of worship. And so actually the CCFA program is very aligned with the mission of our whole organization. And so we would have done it much, much sooner. And the reforms and the changes to the rules around it really made it possible. And I think that was a little extra push for us. And I love that now there's the push of having to say that that all of us would take those families, because I think we've benefited tremendously from having those families in our program. We also raise funds for private scholarships. And like Antonio, the cost of care for us is more than the CFA funding. And so we also have to raise money to supplement that for every child slot that we have. And what's been so beautiful is to see the C3 funding work together with the CCFA funding, and that they have a relationship, and that, for our board and our volunteers that run our nonprofit, they're able to say, okay, the state is prioritizing these families and like kind of credentialing these families to say, this is who we should be helping. And they're also giving us more in the C3 funding because we're supporting these families. And so of course we're going to do that because that's the right thing to do, right? Like it marks the families that need the help, and it takes the burden off us from trying to find those families who need the private scholarships and evaluate that. And that's all done for us. So for us, it's been a really beautiful, marriage of those two programs and in the way they play off each other.
Excellent. I'm sorry, I was just listening to Ellen. It definitely is a great experience working for nonprofits and how you have to be creative. I used to work for nonprofit. That's why I was impressed with that. So in our case, and again, we are completely new to the system here, but we have an experience similar. We decided to move by accepting CCFA students from the very beginning. Basically, we started in August. In November, we were receiving the first one. But what is being possible since we started to get the C3 funds is that in some cases, and again, CCFA is a great program, but not everybody is eligible. And we have had situations where people have come to us. We haven't. First of all, we actually, once we got the C3 funding, we decided to get our private rate completely stable, not increasing, not adding any fees except for tuition, which is not normal in this area, because in this area it is completely different because of the colleges. We have the 5 colleges, so we have a lot of professionals around, and private daycare here is very expensive for some people. So we decided to keep our tuition really not at the same level as others. And in some cases, we have done basically our own scholarship to basically lower the fee for families that were in a situation that it was a hardship for them to pay the full amount that was not that high. And that has been helpful, again, because of C3 funding, because without the C3 funding, we couldn't do that. And we normally don't have more than 2 private students. Here is Nubia. So that definitely similar to Ellen's situation, which is a more complicated because it's a bigger program and it's been there for many years. I think that is reassuring to hear from her, because what we've been doing is basically very little scale what they are doing there, which is great.
Great. I know you've both encountered situations with families who aren't able to afford tuition, but also don't qualify for CCFA. I'm just wondering if you could speak a little bit to how you handle those situations.
Yeah, so it's for us, there's a few categories of people. There's the people who do qualify, and have been on the wait list. We have one family who has 3 children. Their bill is $90,000. Their income is $100,000, and they have been on the list for 3 years, on the wait list. So there's that category where they do qualify, but they're not able to get in. And then we have the people who don't qualify, but they have expenses that make it impossible to have the liquid cash to pay tuition. So in the first category where people qualify but they're on the wait list, I think it's been really challenging because the children born in the last 2.5 years or whatever it's been that the wait list has been paused, those children, none of those children have gotten off, and those are for both of us, those are the primary audience that we serve, right? So all those 2-year-olds, 3-year-olds that are sitting out there who never had an opportunity to get off the list. I mean, it would, when I was looking at your graph and thought it would be really interesting to see in that graph how many of the children on the wait list are in each age category, because my hypothesis is that there's a very large percentage of children under age 3 that are waiting. And so that's really challenging, different than maybe an after school program where those kids are already on the list and they can move around programs and whatever. These kids have never had the opportunity to be on the list. So that's a problem. For the people that might make a little bit too much or not be eligible in some other way, we have been able to help with private funding, but the fundraising for that is just so substantial. It's almost that we would need to really do it justice. We'd probably need like a full-time professional to run that, just because it's ongoing. Once you take the family, if they need $20,000 a year for 5 or 6 years, it just becomes an enormous number for every single child.
So our experience so far is being similar in the sense that we have had actually in the past people that are not eligible for different reasons, and they come to us, and we have been able to do an adjustment on the fee to allow the student to be with us for at least for a little bit of time until they find another solution. And another one, as Ellen mentioned, is these situations where they qualify, but they're on waiting list and nothing is moving. And it is really difficult for these families. And again, if we have the slot available and we can make an adjustment, we will do it. But in some cases, it's just capacity. There's no other places where they can go and have the services at an affordable cost for them.
The last question that I'll ask you all, I want to know you have programs to get back to. Thank you again for giving us so much time today. Part of what we're talking about on this webinar is the progress that's been made in this first year, and part of what we're talking about is kind of what the promise of these reforms could be once they're fully implemented. And so I'm wondering, for each of you, when you think about your programs, if the Commonwealth was in a situation where there was sufficient funding for every child, every family making up to 85% of state median income to have access to CCFA, if there was enough money in the C3 program and structures of that program that it could compensate for you to pay your educators a higher wage, what would that mean for your programs and what you are delivering to children and families?
I think it would be transformational. I think you'd have a different cohort of educators. I think you'd experience educators who are calm and centered. An example today, I spoke with an educator who can't afford health insurance and so can't do the doctor visit that's required by EEC, right? So there's not only, we know that early childhood is a high stress position, just being with the children and navigating all of that, but layer on now that they can't afford basic health care, and basic living expenses, it just makes everything impossible. So I think that first of all, by raising salaries, you get just a more settled, more stable, more invested workforce. And people would see education like they do, like public school teachers do. This is a career. I'm in it for all the ups and downs and the goods and the bads, but I'm going to stick with it because it's a career for me. And then for families, I think it's the same thing. You'd see them be able to relax because the workforce would be stabilized. And so they know who they're leaving their child with, and know that that teacher had been there for 10 years and was really trusted and had a relationship with them from their last child. And I just think it would be transformational for us.
Thank you.
I believe that for family childcare, on a very stable system, that would be enough funding for, paying the salaries that they deserve. As Ellen mentioned, people start thinking about early childhood as a career instead of being basically a stepping stone for the next level. Number one is I'm sure people will be actually starting this career from very young age and getting ready, and that would be very good because then the affordability is going to become because of how many people are entering into the career pathway. In addition to that, in our case, we might be able to basically move into maybe a small group setting, because then we know that it's going to be stable, it's going to be affordable to do it. So that, I think, there are a lot of benefits, and not only for family childcare owners and families, but think about employers. We have talked with employers that they cannot find people to work on a second shift because there's nothing available for the childcare situation. There is, the repercussions will be amazing on everywhere. And also, the kids will be prepared when they go to preschool because they've been on a stable place with, as Ellen mentioned, with very well prepared professionals, giving them all the attention that they need, all the education that they need before they get to preschool. Before here, I used to work for K-12. And, in the last few years, as we lost a lot of childcare on centers and family childcare, the amount of work that needs to be done on the kindergarten, pre-kinder at this public schools is amazing because there's a lot of lack of skills for kids that were never able to go to a childcare because of that situation.
Thank you both so much to all three of you for joining us today. It's so helpful to hear your perspectives as the people who are on the ground running the programs, to know what is working and what remains to be done in order to really make this sector work. So thank you so much for your time. If you are able to stay with us for the Q&A portion, we would love to have you, and also completely understand if you need to get back to your staff.
Thank you for having us. Thank you, Ellen.
Yeah, thank you for all you're doing to support all the early childhood programs. We appreciate it.
I know that some of our attendees had to leave us at 2 p.m. We are going to continue with the remainder of our webinar until 2:30. And so for anyone who has questions, either for or our panelists based on what they've just shared, or any larger questions about the 2024 reforms, please feel free to add those to the Q&A. I'm going to start off with the questions that we already have at the moment. So going back to when we were discussing the pay parity between early educators and K-12, there's a question about the difference in the number of months, and I'll add the number of hours a day that K-12 teachers work versus early educators, and whether that is being adjusted for in thinking about salary. Amaris, I don't know if you want to speak to that.
Yeah, I can certainly provide part of an answer, which is that what we were presenting was just the current reality. So how much, in this case, BPS starting teachers make, and what the average starting salary is for ECE teachers, just to show the gap. I think it sounds like the question has sort of an argument that one might say the gap is even bigger because ECE teachers are getting paid, I'm interpreting the question here, are getting paid less for more work. So we are not, involved in setting the salary scale. But I do believe that that concern is one that EEC is aware of and considering as they consider the new salary guidelines. I can't speak for them, obviously, but it comes up enough that I believe it's something that is top of mind for this.
And I would just add, what got passed into law in the creation of the career ladder, the mandate to EEC to put out the salary scale, requires that salaries be in parity with K-12 educators based on experience and training. And so if you think about, there are a number of different teachers in a classroom in an early education setting. Antonio was just speaking about himself versus having assistants. So there's a variety of positions that are going to be considered when EC puts out the career ladder with salary scale and credentials. And so certainly those factors are being considered along with roles and experience and a variety of other elements. There is a question about recruiting and expanding the pipeline of caregivers, which was not an explicit, I'll just say was not an explicit part of these reforms that were passed in 2024. Neighborhood Villages, we do quite a bit of workforce development and career pipeline work, and so can definitely say there is a lot of thought being given to that broadly. In terms of specifically what is now in statute, our understanding of the motivation is that if we increase wages and benefits, to the point that Ellen and Antonio were both just making, there's the opportunity to attract more people to the field if it feels like a real career option. So that's specific to kind of the law that was passed. There are certainly a lot of efforts underway through a variety of organizations, including our own through EEC, to increase the pipeline for educators and to upskill them. Another question is this dichotomy between C3 and CCFA, and if it would have more of an impact to increase the C3 grant or reopen the wait list.
I'm not sure if that question is directed to me. I think one could do a bigger analysis than what we provided here today to try to come up with a number that would then inform an opinion about that question. But we, I think, see a value for both of them. And as Ellen sort of described when you heard from the panel, they really sort of work together. So that's my take, Liz.
And I think the question brings up a really important aspect of when we're talking about implementation for these reforms, because ultimately, to Amherst's point, we need, if there is limited funding in the next year, which is likely the situation that we will be facing, where is that next public dollar best spent? And that is certainly something that we are working on, and happy to continue the conversation around. As we think about these great reforms that were passed last year and this framework that we now have, that long-term and short-term implementation are both incredibly important. And we want to make sure that what we do and what the state does in each year is building us towards that long-term transformation that Ellen and Antonio were speaking to in terms of what the sector can look like once we have fully implemented and fully invested in this sector. I'm going to end us there unless we have any other outstanding questions, and just say there were a couple of very specific questions which we will certainly answer offline with individual folks. So thank you for posting those. We do see them and we will respond. Thank you all so much for being here today. We are really excited to be talking about this progress that is being made in the sector, and also to continue to move towards the transformed childcare system that we know is possible for Massachusetts. We want to share with you a couple of upcoming opportunities. We'll be continuing this conversation and specifically focusing in on operational funding and the impact of the permanence and changes in the formula to the C3 operations grant, as well as what is possible for operational funding in Massachusetts, with an event coming up in December. If what you heard in this conversation today is making you really interested in how you personally can advocate for and move forward early education policy and funding in Massachusetts, then we will encourage you to sign up for our community classrooms. If you can advance the slide, thank you. We are going to be doing a series of community classroom opportunities throughout this next year. Our first one is Advocacy Academy, which will start in October. This is a series of a cohort, small group going in depth around a specific topic. And our first one is really focused on how to make your voice heard and the advocacy levers that exist. So we encourage you to sign up for that. The registration for both the operation funding event and our community classroom are available on the Neighborhood Villages website. We also want to make you aware of ongoing activities of the Massachusetts state government that are relevant to continuing the implementation and making progress around these reforms. So there are upcoming data commission meetings. They are open to the public virtually to view. There's also a monthly early education board meeting, which you can attend in person or watch on a live stream. Neighborhood Villages also publishes a recap of the meeting every single month, which is available through our Policy Pulse newsletter or on our website. EC board meetings are also an opportunity to give public comment. If there's policies that you heard talked about today that you are interested in sharing your own experience with, or making sure that EEC is aware of policy solutions that you have. Board meetings are an opportunity to do that. And then just as a reminder, much of the implementation, as Amara spoke to earlier, is dependent on funding for early education and childcare. And so the FY 2027 budget season will begin this winter and go through July. And to that question about where do we put the next dollar, this will be the opportunity to really communicate with the governor and the legislature around where you think money should be spent to improve early education and care in Massachusetts. Thank you again to everyone for attending today, and we look forward to communicating with you offline and at future events.